Good morning. I am Mike Leventhal, Executive Director of Tennessee Men's Health Network, the state's affiliate of Men's Health Network. And on behalf of my colleague, Judy Seals-Togbo, and the entire Men's Health Network organization, I want to virtually welcome you to the 2022 Memphis Men's Health Summit. I speak for everyone involved in this annual event. We wish we could all be together in person. And once we put this pandemic in the rearview mirror, we will be back with our friends in person to kick off summer and Men's Health Month. For those of you that did not know, June is Men's Health Month, and it's a time for us to talk about real issues that affect men and boys and their families. So thank you all for taking time out of your day to connect with us and to learn more about serious topics that not only affect men, but families as well. At Men's Health Network, it's our mission to reach men where they live, work, play, and pray with health education messages, health tools, and events like this that highlight cancer and how advanced cancer potentially can be avoided. It's also a top priority for us to work closely with women and women's groups, as they are traditionally the ones that make the healthcare decisions within the household. And we in Memphis have a squad of ladies that are champions for men's health, and that's the Men's Health Planning Committee, the Men's Health Summit Planning Committee. And I'd like to take a moment to recognize them for their efforts in making this event possible. And those ladies are Carla Baker, Katrina Kimball, Bert Fain, Carol Miner, Nikki Wallace, and Regina Dowell. Thank you, ladies, for all your hard work in making this event possible. I also want to thank Sterling McNeil, a longtime friend of ours, and Niels French, and they're also on the committee, and we're fortunate to have their leadership and years of expertise guiding us. The Memphis Men's Health Summit would not be possible without the support of these organizations: Tennessee Cancer Coalition, American Cancer Society, Methodist LeBonner Healthcare, Carpenter Family Healthcare, Church Health, CB First Fitness Nutrition, GastroOne, Memphis River Bluff Black Nurses Association, and Sylvester Fulton with Prostate Petals and Prayers. We are grateful to have your continued support. Before we begin, I've just got a few housekeeping items. I want to give a shout out to everyone who's having a watch party across the city of Memphis, across the state, and across the country. Thank you for joining us. Thank you for hosting the Men's Health Summit Watch Party. Also, our health toolkits will be available to you. We will be distributing those out in the weeks ahead, and we will be sending you out emails as to where you can pick up your health toolkit. Door prizes will be given out throughout the event, so please stay tuned. And lastly, we will be doing a survey of the event, and we want to strongly encourage you to submit your feedback. Good, bad, ugly, we can take it. We want to hear how you think this event went. Now, at this time, I want to introduce our MC for the summit and let him kick us off. And that man is Darren Thomas.
Thank you, Mike, and good morning, everyone. I am just so thrilled and so excited to be here to not only serve as the MC, moderator, host, but also just to take an opportunity to learn myself. I am a young man, only 30 years of age, though the beard may fool you into thinking that I'm in my mid 40s. I am not anywhere near that, thank God. I'm going to enjoy this 30-year-old period, but I'm definitely excited about this unique opportunity to learn myself, not just as a man, but also as a soon-to-be father. My wife and I are expecting our very first child on July the 15th. Don't ask me how many weeks away that is, because I can't remember. And my wife is not on the call, so if you see her in the streets, pretend like you didn't hear that part. But I am just thrilled and excited to be with you all. I'm so glad that each one of you all have decided to join us this morning to take your learning and your education to the next level as it relates to men's health. As Mike stated, the theme this year is the ball is in your court. And that is a powerful theme. As we saw, many of us may have seen on Thursday, the ball wasn't in Golden State's court. It was actually in the Boston Celtics court. But what Boston really showed us was, hey, at the end of the day, it's not just how you start, but it's also about how you finish. And so our health is not just about how we started with our health, but also how we actually finish and continue in our health journey. So sit back, enjoy yourself. Make sure you ask plenty of questions. Drop any comments that you have. Let's enjoy this time together. Let's enjoy this moment of learning, and let's enjoy this moment of fellowship. Just know that me as a moderator, I'm not your usual moderator, so I'm going to throw a couple of jokes in. I'm going to throw a couple of serious moments in because I like to have fun, but I also like to learn. So it's going to be fun, but it's also going to be a lot of learning. But I'm going to make sure that we just roll right through and enjoy each other's time, because it's going to indeed be a great time, especially when you got these powerhouse people coming on to speak, coming on to talk, coming on to give us a welcome. And we got to first start with the powerhouse who's going to provide for us a moment of prayer, because in this season, we all do need some form of prayer. And so without further ado, I want to bring on this powerhouse who is the chaplain, one of the chaplains at Methodist University Hospital, none other than Chaplain Angelo Conway, who will lift us in prayer.
Thank you, Darren. Let us pray. God, we thank you now for this time we're about to share. God, we thank you, Lord, for the information we're about to receive. And God, we pray now for those that are part of this Men's Health Summit. And God, we ask that we will apply what we have learned on today. Bless us in the name of our Lord. Amen.
Amen. Amen. Thank you, Chaplain Conway. We definitely appreciate you. You know, it is always key to note that prayer is a powerful tool for us. It is a powerful component of our not only physical and mental health, but also a spiritual component. So thank you, Chaplain Conway. Now, of course, I told you all that we got some powerhouses on this call. Y'all gonna hear from one of the major powerhouses a little later in the form of Dr. Kelvin Pollard II. But first and foremost, y'all, I'm so thrilled because we got, this must be the connection through the Men's Health Network, because this brother is always busy. He's always somewhere in a million different places at the same time, but he's doing his thing, handling business, taking care of the entire county of Shelby. I am so grateful and so honored that we have with us to share some major remarks, none other than our mayor, the mayor of Shelby County, the Honorable Mayor Lee Harris. Let us welcome him with your reactions in the chat, whatever the case may be. Let us welcome our mayor, Mayor Lee Harris.
Well, very good and good morning, and thanks, Darren, for facilitating, and thanks for your energy on this Saturday morning. This is a beautiful morning and a great occasion And I'm really pleased to be here to welcome all the attendees to today's virtual convening. I'm the mayor of Shelby County, and Shelby County is the largest and most diverse county in our state. And in my humble opinion, it's the greatest county in our state. And with 950,000 residents here in Shelby County, 7 great cities, including the city of Memphis, we have lots of wonderful things going on, and we have some very special people in our community. But we do have our challenges. And so I think that's why this morning's convening is so important, because a lot of the challenges in Memphis and Shelby County stem from healthcare access and knowing more about prevention. And so I want to thank you, Darren, and Regina, and the Men's Health Network for pulling us all together and centering our attention on some of these really, really critical issues in Memphis and Shelby County. We know that across our neighborhoods, particularly our neighborhoods in our historic core, that most folks don't have a relationship with the primary care provider. And we've looked at the statistics and worked with a lot of partners to survey our residents. And we found that in some of our neighborhoods in our historic core, it's upwards of 80% of individuals don't have a relationship with a primary care provider. So they're not going to see a doctor regularly, or going to see a nurse or someone that can provide them information on prevention, how to keep healthy, how to pay attention to their diet, and a variety of other strategies. And so instead, they let some of their conditions that could have been prevented worsen and spiral out of control, and end up, in many cases, using emergency rooms and suffering from severe illness that's unnecessary. So what comes to mind for us most often here in Memphis and Shelby County is the incidence of things like diabetes and blindness and heart disease and stroke and amputation. A lot of illnesses that could have been prevented, or at least not allowed to worsen, with a relationship with a primary care provider and with an emphasis on prevention. And so this is a conversation that's long overdue. I'm really, really pleased to bring greetings on behalf of Shelby County government and all our municipal partners. And I'm just thankful to be here. So welcome and good morning.
Thank you, Mayor Harris. We appreciate you. We appreciate your words, and it is a great reminder for us all as men, and for those who are not men, who have men in their lives, to be reminded that we have to take preventative measures as it relates to our health. Let us go after pursuing what needs to be done. Let us go get a checkup. And matter of fact, Mayor Harris, I actually need to schedule my appointment with my primary care physician before my son gets here, so that I can make sure that I'm in health. Because those primary care physicians, those primary care visits are important. They reveal a lot for us, and they could prevent us from actually journeying and making a journey towards the actual emergency room, if we actually just take an opportunity to go. Let's go. Let's get up and go. And I challenge you not only to get up and go, but remind your other brother, get up and go. Let's go together. Let's take an opportunity to walk together to this doctor's office, and let's remove any stigmas that are related to their visit to the doctor's office. I'm gonna get off my boat. I'm gonna get off my tangent in that regard. Again, let us again stop and celebrate the great words of our mayor, Mayor Lee Harris. Feel free to give the reactions as you click, or drop a comment in the chat. I already see somebody dropped a comment in the chat for you, Mayor Harris. So we are so grateful for you. We're grateful that you took time out of your schedule today. And as Mayor Harris said too, y'all, it is a beautiful day outside. It's so nice out there. Oh, man, let me tell you something. This will be a good day to go for a nice little walk before this Memphis heat starts to wear you dry, because I don't know what's going on with this heat outside. outside. It is warm, but I am going to make sure, let's all do our part and make sure that we get outside and enjoy this beautiful day today. Thank you all for dropping those comments in. Next, I want to take an opportunity to pause and recognize the amazing sponsors for 2022 Men's Health Network. We are so grateful for places like Methodist Labana Healthcare, the American Cancer Society, Tennessee Cancer Coalition, the C. Baker FirstFitness.com, Nutrition, and of course, Church Health. These amazing organizations are ones that have helped to make this event possible, and we stand forever grateful for their commitment, for their work, and let us continue to celebrate them in their great work. And so I want to stop and pause and drop a couple of statistics on you, brothers and sisters who are here with us. Did you know that every day in Tennessee, look at this, look at these key stats, 96 people are diagnosed with cancer? In the chat, somebody should just say, wow, wow. 16 people were diagnosed with lung cancer. I want you to catch these two, and especially as we're looking at this Men's Health Network, as we're really focusing on men's health. 12 men were diagnosed with prostate cancer. 12 every day, 12 men. And 2 men died from prostate cancer. 2. I mean, we as brothers, these stats should really, really, really help us and encourage us and push us to pursue preventative measures. Early prevention is possible, but we have to be brothers who stick together and actually say, hey, let's go get checked out. Let's actually pause. Let's actually do what we need to do to be screened. It is amazing what can be discovered and what can be found and how we can ensure that we pursue good health. I'm just so excited. I'm telling y'all, I'm really excited to be here this morning. I'm really excited that we are here in this conversation, not only to talk about what has happened, but what we can do in order to survive. And so now I am just so excited and so thrilled that we can bring on a couple of people who will help us talk about this component of surviving. Let us now welcome Reginald Hollywood Thompson, a 2-time prostate cancer survivor, followed by Sylvester Fulton, who'll share about prostate, petals, and prayer. Mr. Hollywood, I'm so glad to hear from you, good brother. I can't wait to hear what you got to say, brother.
Man, this is the day that the Lord has made. Like you said, I am a 2-time. But man, I tell you, it's been a wonderful journey because of the people that's been behind me. You know, men, we got to get it together. We got to get this together because we're lacking on what we're supposed to do. And what we're supposed to do is just go to the doctor. We got to get checked, man. You know, some of y'all have heard me talk before, and some of y'all haven't. I am a disc jockey around the city of Memphis and the surrounding area. And when I was diagnosed with prostate cancer, a friend of mine told me, said, you know, Hollywood, you going through this for a reason. I said, man, what you mean I'm going through this for a reason? He said, you're going through this for a reason. He said, the reason is because when you on that microphone, you the headline. He said, everybody listened to you. And I went home and I thought about it. Man, I was at the club one night, I was jamming so hard. I mean, I was jamming hard. and I just cut the music off. And I asked for every man to raise his hand that was 50 and over. Then I asked every man that has had their prostate checked. Well, after I came out and said that a couple of years ago, well, no, several years ago, because I was 50 then, you know, 20 of my friends got checked. 8 had prostate cancer. All my friends that got checked and all my friends that had prostate cancer is still here with me because they took the time out. Now, men, we are stubborn, we're hard-headed. So I'm talking to the women. Ladies, you got to be the backbone. Y'all are our belt. Y'all like suspender studs. Y'all holds us up. So you tell your man, your boyfriend, your brother, your cousin, or just your friend, this is what got to be done. Men, get out of that closet about, I don't want this done to me and I don't want that done to me. Man, that's just a bunch of baloney. You know, these doctors out here for a reason, and they to help us. So you got to get tested. And when I first was diagnosed with prostate cancer, my doctor kept saying, he said, you 50 and you black. You 50 and you black. Now, the first thing I said, my doctor was, what is he trying to say? Well, he was saying that prostate cancer moves faster in blacks. Why? They don't know. But this is my theory. Men, all lives matter. I need all men, creed, color, religion, whatever. I need all men to get tested. I need all young men, old men, whatever, to get tested. Because the quicker you find out, the better it is for you. It's nothing like going to the doctor and say, okay, you all right. But when that doctor tells you it is cancer, that's one of the worst feelings in the world I ever been through. And it was so bad because my mother hadn't been too long past. So my mother wasn't there. But what did I have with me? Whew. Boy, I had the strongest wife in the world to stand beside me. To just follow me through this journey. And you know, this journey is not as bad as it sounds because I'm able to sit here and just explain to people that this is what got to be done. You got to be tested. You got to be tested. I mean, a lot of people, y'all go to the club. A lot of people, y'all do a lot of shopping. A lot of people like to go look at cars. All that what you do, it don't even take that long when you go to the doctor. It's just a few minutes. The most time is gonna be wait. But that's the time that you're gonna find out about you and your status. Because y'all, you know, we ain't got but one life. And I wanna live mine confidently. I wanna ride my motorcycle. I wanna play with my grandchildren. Man, I tell you, but ladies, it's gonna take y'all to push these men. And y'all see this beard I wear? I don't wear this for a style. I started growing this beard when I first was diagnosed with prostate cancer. This beard here on my face is a symbol of those who have lost the struggle and those who are still in the struggle. Hey man, I just need y'all to get tested. I need y'all to find out what's going on with you. You know, a few minutes can save your life, bro. A few minutes can save your life. I'm not gonna hold up any more time, but I want y'all to know to be careful, be safe. If don't nobody love you, Hollywood love you. Y'all take care.
Okay. Get my name on here now.
Thank you, Mr. Hollywood. We appreciate your amazing words and your testimony that you did share. One of the key things that I really picked up, it's a couple of key things. One was simply this: get tested. There is a necessity for us all as men to take the opportunity to get tested and be serious about getting tested, regardless of our age or what place in life we're in. There's always a need to get tested. I remember hearing about, as you all may have heard about, Chadwick Boseman, who is known as Black Panther, and our king, as we sometimes would call him in the Black community, being diagnosed with cancer, and he was young. And so this is a word, not just as Mr. Hollywood shared, it's not just a word for older gentlemen, but this is a word for all men. Take the opportunity to get tested, but also this next thing is who's in your corner? Who's the people that are actually in your corner? Who are the people that, as you look around you and see, that are there to support you and look after you? I compared this, of course, this is our theme, is the ball is in your court. Same way when Steph threw a no-look pass in that game one to Clay and walked away and turned around and knew who was in his corner. He knew Clay was there and was going to make the shot. Who's in your corner there that you can actually throw the ball to and is going to make the shot? Who's there in your corner that's there to cheer you on and support you as you make that journey to having a healthier lifestyle? Who's actually there in your corner? That's a powerful thing to know. So let's give a hand and continue to encourage and show gratitude to Mr. Reginald Hollywood Thompson for that amazing words, that's amazing story of a survivor. We're so grateful for you, Mr. Hollywood, for that. Thank you so much. And just like you say, you love us, we love you too. And we truly do appreciate it. Next, would love for Mr. Sylvester Fulton to come on and share with us about prostate, petals, and prayer.
Good morning.
Good morning.
Okay. I don't see me. I guess you can hear me then.
We can see you and hear you, Mr. Fulton.
You can see me? Okay.
Loud and clear.
Good deal. Well, good morning, everybody. First of all, I'm thankful you had me on to talk about my experiences. I'll be brief. In 2015, I was diagnosed with prostate cancer. And I began to worry a little bit, but I ended up getting a second opinion at the Cancer Treatment Center of America. And once I got down there was so many options for me other than just surgery, which was being talked about heavily in Memphis. So my point is, and I'm thankful, to make the story short, is that my cancer was detected early. And my bike ride that we started 4 years ago called Prostate, Petals, and Prayer is intended to advise men to get checked up early and the purpose of early detection. So for me, I was able to look at all the options as opposed to just surgery. And so basically I picked this process called HDR brachytherapy. It was 2 radiation treatments 3 weeks apart. I had my prostate and have no side effects. And that's been since 2016. So the Prostate, Petals, and Prayer event, basically it started as an event in Hyde Park, Hollywood, Fraser, and Douglas, a 10-mile bike ride, where we stop at different churches and talk about prostate cancer awareness, early detection, and disseminate information. We didn't do it last year because I was kind of wore out and tired with the pandemic like it was. So it's coming back this year on September 17th. We're going to format it differently. We will have a gathering at the Greater Mount Zion Missionary Baptist Church. I think it's 1270 Chelsea Avenue. That's our headquarters. But this year, the bikers are going to ride in to the church to attend the rally and then ride back out to our origins. But we invite anybody to come out. We have great partners. One of our partners has provided free prostate cancer screening and very discounted cost for the test. But we had an issue trying to find people. Most guys just were not open to it. So this year we decided to create our own audience and maybe we can get people to step up, if not just to be aware of the importance of early detection. So at this point, again, been cancer-free since 2016, and with no side effects. I say no side effects, but the aging process is playing with my mind too a little bit. So, but I'm healthy and I talk about it all the time as much as I can. And I believe that it's a cancer that can be dealt with, but people got to know early they got it. So at this point, we're also targeting females, wives, grandmothers, sisters, because our men just won't get checked up. But I talk about it a lot. I was out at lunch the other day, and just by happenstance, I met a friend of mine that had the same issue, and he was open up to talk to me. And basically, I'm telling him the same thing. You know, don't panic. Get your options, and there's things you can do. But just don't panic. So, but prostate present prayer would be September 17th. I'll give more information now as we started planning. Planning actually start next week, but it's going to be a good event. It's always the third Saturday in September. Are there any questions? Anything else I could add? I can't hear.
Sylvester, this is Mike, and I want to applaud you for what you do. And I want you to know that Men's Health Network has your back. And if there's anything you need in order to help make that event a greater success than it already is, please reach out to us and we can make that happen.
We'll do. And I want to thank you guys for being supporters since day one. Jude has been, man, she's been phenomenal from day one. If I don't get started planning early enough, Judy would call me and tell me what you gonna do. And so she keeps me on task. She's outstanding. I appreciate everything she's done.
She's right here, Sylvester. You haven't seen her probably much today. She's behind the scenes, but here we go.
Thank you, and we got to go up on that for next year, this year.
Okay, there
I
you
need to
go.
get past the pandemic thought.
I think we'll be fine. As long as the difference this year is, instead of me trying to find 40 bikers, we're going to take a set number and we're going to ride like Go GM Go, just take off and ride. Maybe start at the Penal Farm and have a stop at Overland Park to pick up those bikers who just want to have a fun ride. I've learned over the past 4 years, biking is very serious in Memphis. And most guys that bike want to ride many miles at a certain speed. So hopefully this year we'll be able to track the fun riders and the serious riders.
Sylvester, man,
Yes.
keep on doing what you're doing. But look here, we need to touch bases also, man, because we like, I ride motorcycles. All my friends ride motorcycles. We like to join up with y'all.
Okay.
And ride and get together, you know, sit around and talk and video stuff and just send stuff out and just pass the word on this, man.
Okay.
And because I've noticed the churches that you were saying out in North Memphis, that's where I'm from. So
Okay.
so we'll get together, man, and touch bases and work together.
Okay. Good deal. I look forward to that.
That'll work.
Thank you. Thank you in
All right.
advance.
All right.
Mr. Fulton, thank you so much for sharing, for really being here, and for the work that you're doing. And I want to hit on a couple of things that two big things that you really hit on from what you stated. One of the things you said was don't settle. You talked about exploring your options, not just settling on the first opinion that you picked up from the doctor. Was that's accurate, correct?
Right. Exactly. That's right.
And then
I think,
and go ahead, Ms. Fulton.
well, the issue was a lot of people who I spoke to when I was researching, a lot of guys would say, hey, just cut it out. Don't worry about it. I've been fine for 8 years. And I was looking at that 75% surgery, but it's the other options that meant a lot to me, and say, hey, you can wait, or you could do this bracket therapy. And what was really strange about my process, I like talking about it because it was totally painless.
Mm-hmm.
It was 2 radiation treatments 3 weeks apart. I got my first treatment December 30th, 2015, and my second one was January 20th, 2016. And it was without any pain, you know, with no pain at all. And I just thought that was amazing. God sent that I can go through that. And because so many people have so many horror stories. So But I would tell anyone though, get checked out, know your Gleason score, get the biopsy done. We're scared of that for some reason. To know how serious or advanced your prostate cancer may be. But don't be afraid to know your numbers. And I tell people all the time, you got to know them, and once you find out, it may not be as bad as you think it is. It's something you can deal with.
Absolutely. Absolutely. Thank you, Mr. Fulton. I
You're
definitely
welcome.
appreciate you so much for your time. And we'll make sure that we get that information from you on
Okay.
the prostate petals and prayer, so that people will be able to join in and take part in your event.
Okay. Appreciate it. I'm looking forward to it. All right.
Absolutely. Thank you, sir. We appreciate you.
Thank you. Thank you.
You all let us again in the chat celebrate Mr. Fulton, Sylvester Fulton, and the amazing work and his story and testimony on how not to one, don't settle, but also two, don't panic. Those were the two big pieces that I really picked up from Mr. Fulton. And I hope that you picked up some nuggets as well, as we continue to ensure that we move towards prevention, really looking at ways in which we can do a better job of making sure that the ball is indeed in our court. Well, we come to one of my favorite parts of the program, which is the prizes. And now turn it over to Katrina for the prizes.
It's time for some winners. Well, put it this way, everybody's a winner. Even if you don't get a prize, everybody's a winner. Good morning, everyone. I'm Katrina Kimball. I am so excited to be back with Men's Health Network again this year. I have on my blue, one, because that's the color of Men's Health Month. So make sure you wear some blue this month to help promote it. I also am very committed to this because, one, I lost my father to prostate cancer. Also, I'm the proud mother of 2 sons. So I stay on them about going to the doctor, and I have 2 grandsons. So this is very important to me and my family. And we just want to support this work because we need our fathers. Father's Day is coming up. We need our fathers and our uncles and our cousins. So we want y'all to stay healthy so y'all can share that wisdom and pass all that generational knowledge down to us. So this year we did the prizes a little bit different. Last year we did a wheel and we put names on there based on the people that registered. So this year we decided to do a little different. We're going to be rewarding the people that actually logged in. So our first 2 winners for today, and you're going to receive a gift card. We will follow back up with you to obtain your mailing address. Our first 2 winners are going to be Mr. Walter Hunter and Marshawn Kelvin. So those are our 2 winners for this section. It's Mr. Walter Hunter and Marshawn Kelvin. So let's give them a clap of hands for them and celebrate them. Again, even if you don't get a prize today, remember, we're all winners. So I'm gonna turn it back over to you, Darren.
Congratulations to our 2 winners. So excited for you. If you are feeling in the giving mood, feel free, whatever the gift card is, to think about your boy. Feel free. If it's a food gift card, definitely think about your boy because I'm a foodie. So send it my way. I'll send you my mailing address after you get the gift card. I'm just kidding you out. So I am so excited now for us to have what I think is going to be an amazing presentation. I told you all we got powerhouses that are moving through this program, and we have another powerhouse who's going to give us an official presentation. I am so excited and thrilled to introduce to you all as a keynote, as a special presentation, all the way from St. Louis, Missouri. He is a great gentleman, and I'm so grateful that he is here with us today. He is the chief resident physician of internal medicine at St. Louis University, and I am so glad that he is here with us. Would you all please help me in welcoming the one and only Dr. Kelvin Pollard.
All right, good morning, everyone. Thank you so much, Darren, for that warm introduction. Again, my name is Dr. Kelvin Pollard II. I'm a current chief resident physician, the Department of Internal Medicine at St. Louis University. So before I start, I'd like to definitely let everyone know I have no financial disclosures, and the information that I'm discussing is meant to be educational. I hope that after you leave today, that you'll feel empowered and engaged and be able to have meaningful conversations with your primary care physician. So I think everyone in Memphis probably knows who this is. And so I have a special message from Jude. He really needs everyone to be healthy and well, so y'all can basically root him to a championship next year. And so hopefully you can take this information, be prepared to be at the games, and next year they can win that championship. So my objectives for today are very simple. I want to be able to educate you. I want to be able to empower you. And then once you leave this presentation, I want you to be able to be engaged and be able to communicate with your primary care physician in order to basically take control or get that ball in your court and take control of your health. So let's jump right in. We're gonna talk about the case of Mr. Jones. So this is a 45-year-old African-American man who basically presents to his local primary care clinic in Memphis, Tennessee. And he's just following up because he has hypertension or high blood pressure. Good for him. He's taking all of his medications as prescribed. His blood pressure is well controlled. And good, this is another important thing. He's a non-smoker. He takes very minimal alcohol intake. And fortunate so far, he has no family history of cancer. Now, Mr. Jones recently attended a local men's health conference, and he was actually educated on the screening guidelines for colorectal cancer. And so he's going back engaged and empowered, and he says to his doctor, "Hey doc, should I be screened for colon cancer? And if so, how?" So I'm hoping that there's a loud, resounding, absolutely yes on this call that Mr. Jones needs to be screened for colon cancer. So let's jump in and talk about some quick facts. So as we know, colorectal cancer is the third most common cancer in the United States of America. And in fact, due to colonoscopies, it's thought to be one of the most preventable types of cancers. And so as a physician, when I'm in my clinic with my patients, I'm constantly reiterating the importance of regular screening, because by screening, we have the opportunity to then remove precancerous lesions that could eventually, hopefully prevent developing colorectal cancer later. And research shows this can be up to about 90% if you're getting a colonoscopy. Now, another thing to remember with colon cancer, unlike prostate and breast cancer, our screening colonoscopy, in the case of colorectal cancer, can actually be prevented and not just detected through colonoscopy. And I'll talk about later more information about colonoscopy. And then last, about 1 in 23 men will have a lifetime risk of colorectal cancer. So the best thing you can do is get screened and take action to prevent developing cancer later. So some other things that I wanted to point out today was that there are definitely some things that increase your risk for colorectal cancer. And one being, if you have a family member, specifically a primary family member, so mom, dad, sibling, it's very important that you are screened. And we also recommend a lot of times that you do this 10 years before that diagnosis. And so you're probably wondering when you go to the doctor, why are they asking me about my mom, my dad, my grandparents, my siblings? This allows us to appropriately stratify you and know what your risks are for disease later. And so I know sometimes in our communities, we don't talk about our health. And so it's almost like you need to have a family tree to basically create and say who has what. And so you can know, and you can take this information to your doctor. And by doing this, you can later, again, take action and prevent a disease later. And if you are a cigarette smoker, you definitely increase your risk. So if you are smoking, talk to your doctor about opportunities to quit. And then of course, being overweight, if you have diseases like ulcerative colitis or Crohn's colitis. And then unfortunately, if you are African-American race, again, this also is shown to increase your risk for developing colorectal cancer as well. Now, I really like this slide from the American College of Gastroenterology, because I think at least once a week, I get a patient that comes in and says, I have no risk factors. I'm healthy, I don't have high blood pressure, I don't have diabetes, I have a great diet, I exercise, and I do all of these things. And no one else in my family has had cancer. Well, guess what? You could be the first. And so the one thing that I want to reiterate is that the single biggest modifiable risk factor for colorectal cancer is a failure to be screened. So without being screened, you have no power. You are unable to act and prevent disease later. So once I'm saying again, is the best thing you can do is to discuss with your doctor about your screening options. And then this slide is kind of busy, but I really love it because it goes over key things that I talk about in my clinic with my patients. And so what I want you to take away today is 45 is the new 50, okay? 45 is the new 50, meaning we previously used to say you should start your cancer screening for colon cancer at age 50. We have new guidelines now that are recommending actually to start at age 45. I also remind my patients, basically, and I put it in the chat as well, if you're a person that doesn't have chronic conditions and for the most part you're pretty healthy, try scheduling your primary care visits around your birthday. And so that way you will never forget. So every single year, you know, somewhere plus or minus 1 month from your birthday, you should be going to the doctor to have these discussions. So again, with colon cancer, there are kind of like two pathways that you can take. There's the one-step test option, which is listed here, and then you have the two-step option. The one-step test is generally talking about your colonoscopy. And we have an awesome gastroenterologist later that's gonna actually discuss what entails the colonoscopy. But again, this option I really like, and I try to really encourage my patients to do, because if you do this one, you can do this starting at age 45 every 10 years. Again, if they find something on the colonoscopy that may change that duration, it could end up going 1, 3, 5, or even, you know, some other duration depending on what they find on your colonoscopy. Oh, sorry about that. The other option, you have kind of like stool-based tests, specifically like FIT testing, and also there's one called a multi-target stool DNA. Now, these tests, some people, for whatever reason, whether it's a contraindication to colonoscopy or they just simply absolutely don't want to do colonoscopy, then these options here might be better for you. The only thing, if you look on the slide, if those tests are positive, you still have to go around and go back to the colonoscopy. And now it no longer becomes a screening colonoscopy, it actually becomes a diagnostic colonoscopy. So again, for me, I would say go with the one step, knock it out, and don't have to do it for another 10 years. But again, I've also been asked by my patients, which test is the best test? And my response is the best test is that gets you appropriately screened. All right, and then this is just another way to, again, show you recommended frequency for the different screening tests. Again, the biggest one here, colonoscopy every 10 years, starting at age 45. And this could be earlier, again, dependent upon what family history or primary conditions that you personally have. Or you could do the FIT testing, which is a stool-based test every 1 year. And you have these other alternatives. But again, keep in mind on the alternatives, if there is positive or they find something abnormal, again, you still have to swing back and have that colonoscopy. So again, I reiterate, think about if you have no contraindications to consider doing the every 10-year test. All right, and then last, this is again, just trying to point out those fallacies in thinking. The first thing I get also is no one in my family has colon cancer. And again, you could actually be the first. And so roughly 5 in 100 people are destined to get colorectal cancer in their lifetime, even with no family history. So this is why it's very important to be screened. And then I think Darren mentioned Chadwick Boseman earlier, and I also brought him up too, because again, he was 43 years old when he died from metastatic colon cancer. And so again, I'm not sure what his symptoms were or what was going on in his health or his family history, but this just goes to show you why it is very important to be actively engaged with your primary care physician and having these discussions, and also bringing to the table family history and any symptoms or abnormalities that you might notice. And in some cases with cancer, it's very silent until it's it's progressed. So keep in mind that as well. So that's why it's very important, again, to have these discussions with your primary care doctor at least once a year. So let's step into another case. The next case is Mr. Smith. So Mr. Smith is a 56-year-old male, and lucky for him, he has no past medical history, and he also presents to his primary care provider for routine follow-up. He too attended the local men's health conference in Memphis, Tennessee, and he was educated on the importance of lung cancer screening. Now, this is something that we're not too happy about, but Mr. Smith has been a 1 pack per day smoker since the age of 26. He's attempted to stop, but unfortunately has been unsuccessful. And so now he's been educated, he's been empowered, and now he's open to engaging with his primary care physician. And so he poses a question as well. He says, "Doc, should I be screened for lung cancer? I mean, I don't have any symptoms." And so again, I hope everyone on the Zoom is saying absolutely he should discuss and consider being screened. So here are some quick lung cancer facts. Most patients are diagnosed with advanced disease, unfortunately, and lung cancer is curable when diagnosed early. So it's usually, the earlier the diagnosis, the better, most of the times, the better the prognosis. And in many cases, lung cancer can be the #1 cancer killer in the US. And this is simply back related to that first point, that a lot of times it's not until the disease is so advanced that we find out about it. And so this kind of summarizes who should be getting screened for lung cancer. And so if you're age 55 to 80 and you're a current or former smoker, that's the first thing. And then the second thing is if you have greater than 30 pack year smoking history. And so what I mean by pack year history is we take the number of packs per day times the number of years smoking. So our patient had 1 pack per day for 30 years. So he met the criteria and he was also the age. Now keep in mind, sometimes we all know a smoker, I'm pretty sure, and they kind of cough all the time. So it's kind of hard to say, when did that cough become cancer, or when did that cough become malignant? Could it just be like an underlying COPD or something like that? And so for them, that's another reason why you have to be engaged with your primary care doctor. They can really ask those difficult questions. And of course, coughing up blood or new or increasing shortness of breath. And again, a lot of times these things are late in the diagnosis. So again, many people simply don't have any symptoms and we find it on a screening test. So there are definitely benefits to screening. Again, by early detection, you have the opportunity to decrease your chance of dying from lung cancer. And the detection of lung cancer early, it's important to detect it when it's most curable. And we suspect that there are over 7 million Americans who are actually eligible for lung cancer screening. And by doing this, if we screened all of them, we could potentially save over 22,000 lives. But unfortunately, less than 4% have actually undergone screening. So as with any test or diagnostic modality that we use in medicine, there are definitely risks of screening. And so I want to be able to talk to you about that as well. So there are the risk of false positives. And this is particularly important because we could find a nodule or a spot on your CT scan. But keep in mind, over 95% are not cancer. But I don't want to be in that 5%. So if you are a person who's a smoker, you definitely want to be following up and making sure that you're doing those appropriate things to prevent cancer. The second thing, you could also get a false negative, meaning you get a scan, we don't necessarily see a specific nodule or a spot, but all that scan tells us is that it is less likely that you have cancer, but it doesn't tell us that you won't get cancer in the near future. So that's why you have to undergo screening yearly. And how do you screen? Simply undergoing a low-dose CT scan here. With this test, there's no IV or dye used, and usually it takes less than 1 minute. And if negative, you should then undergo annually for 1 year. And of course, that's if you meet those criteria that we discussed. And lastly, I could not, leave this presentation without encouraging any of our men, women, children, anyone that's continuing to use tobacco, please consider stopping. This is one of the best ways that you can ultimately prevent getting or decrease your risk of getting cancer. So I do have some takeaway points, and I think this is most important. And this goes across the board for men, women, children. See your doctor regularly, at least yearly. And I cannot reiterate the importance of considering scheduling your yearly visit somewhere close to your birthday that you won't forget. And then at every visit, I encourage my patients to be actively engaged in their healthcare, because really the relationship between the primary care physician should truly be a partnership. So you should be bringing your concerns and you should be bringing your knowledge and your information in order to make an informed decision to take advantage and take care of your health. Of course, if you're 45 or older, discuss with your doctor about colon cancer screening. Again, for my patients, if they have no contraindications, I really try to encourage them to undergo the colonoscopy. But if for some reason they don't, we discuss those other options. But the most important thing is to pick a screening test for you and do it at the appropriate intervals. And then, of course, again, if you are a smoker, first thing that you should do is discuss with your doctors ways to stop. There are medications, there are gums, there are patches, and there are also classes that you can take for smoking cessation. And research shows that not just doing one of those modalities is best. Usually those individuals who choose a patch or a gum and they do smoking cessation classes, they're more likely to actually quit and stay or remain or abstain from smoking. And then, of course, again, work towards eating, living, and thriving. And finally, I hope that you all feel educated. I hope that you feel empowered. And I hope that you will walk away today able to engage in meaningful conversations with your primary care physicians. Thank you so much, and I wish you all well.
Didn't I tell y'all Dr. Pollard was gonna come bring the heat? Did I not tell you that Dr. Pollard was coming with some great energy, some great knowledge that we needed? Let's stop, pause, and first just celebrate and thank Dr. Pollard for his amazing presentation that shared a lot of different things, a lot of different information that was actually shared during this point. And so before I give what some of my takeaways were, I know that we may have some questions that will be raised for Dr. Pollard. And so I would love for those questions to come in and to ask Dr. Pollard as he's here with us right now.
Hey, Darren, we have several in the chat.
Absolutely.
So I will read one of them, and then if you want to take one, we'll go that way. One of the questions we have is, it just went away. Where'd it go? Okay. One question was, how do you build a good relationship with a doctor? Mayor Harris, when he was talking, he said there's about 80% of people that don't have a current PCP. So what are your recommendations on how to start building a good relationship with a doctor?
That's a great question. I think I always say this to my patients and also my family members. We are very good at looking at when we want to get a haircut, when we're going to get we want to get our car fixed. We try to get recommendations. We try to find those people who we feel best or appropriately fit our needs. If for some reason you're going to a doctor and you don't feel like you can be open and candid and you can be honest and have those discussions with that physician or that healthcare provider, then you should look for another one. And definitely, if you feel like you can't answer questions or they're talking in terms that you don't understand, you should definitely stop the physician or the healthcare provider and say, hey, I don't understand what you're saying. Explain that to me. And if you after doing that and they still are not able to do that, then that's when you look for another option. And I always say everybody's not for everybody. So I think if you are not feeling comfortable, you should let them know and try to see if you can work on that. But if it doesn't work, it's no hard feelings. Get your records and go to see another physician.
Okay, we have another question for you. They want to know, after a certain age, most screenings require you to be of a specific age. After you get that age, should you still continue to get the screenings? For example, if the screening says you only should do it to age, I don't know, 55, if you're 56, 57, you still go back and get those additional screenings anyway, just to be on the safe side?
So that's a good question. And so after you kind of like met that end age, that's when you have a discussion with your primary care physician, and it'll be different for every single person. So that's a discussion that has to be had, and it's basically a shared decision module. It's based on your life expectancy, if you were to find something, now you're like 80, are you going to be interested in undergoing cancer treatment? Or if you found something, are you going to want to do something about it? So it kind of changes. And so that's where it's important to take that patient-centered, individualized healthcare idea. And so that's why I'm saying having those open and candid conversations with your primary care physician will really empower you and help you to get individualized care for your specific situation.
Okay, and then I have one last question. How can we help the next generation? So we know that Men's Health Network focuses on the health and well-being of men and boys. So what can we say to the next generation, to the younger parents, to get them to start getting their kids to go to the doctor early?
I think one of the biggest things that I would tell younger men and also boys, I've been afforded the opportunity to have a patient panel that has a wide variety of ages, and specifically I've been interested in those ages of like 18 to like 40, just because typically they're the ones who really, that's the opportunity where you can really start early and getting them engaged in their healthcare. And so I think after just getting them past the fact of like being nervous about going to the doctor and saying like, hey, I'm here to like help you. I'm not here to find something wrong. I don't want anything to be wrong. I actually want to keep you healthy. And then I think just being able to be comfortable and engaging with your patient, I think that is what will likely have them be more open. Because I've had patients that have been very much so open with me, telling me lots of stuff, maybe some stuff that I probably didn't even want to know, but they told me these things because they felt very comfortable with me. For my younger boys, I would say, I think you have the opportunity, whatever habits that you're starting now, it only gets harder and harder to stop those habits later. And so don't pick up the habit of smoking cigarettes, using tobacco, excessive amounts of alcohol. All of those things have health complications. And I think specifically for college students, I think Planet Fitness is actually offering like free memberships for college students. So just going to the gym and working out, staying active, those are the things that you really can do to really stay healthy early on. And then if you have family members with like diabetes, high blood pressure, it's more important for you to start earlier, because what we see is like high blood pressure came to my parent in their 60, or my grandparent when they were like 80, 70. And then the next generation, for whatever reason, it got worse. So the next person in their 50. And then now you have the 30-year-old that is now hypertensive. And then later, now it's the 19-year-old or 20-year-old. So because it seems like our behaviors get worse and worse with every generation. So again, this is an opportunity for you to really think about just staying healthy, stay active, less video games, more get outside, swim, do some physical activities, ride your bike, go on a walk. All of those things, those little bitty things can actually improve your health in the long run.
Well, thank you so much, Dr. Pollard. And I'm gonna turn it back over to you, Darren.
Wow, Dr. Pollard, thank you so much for sharing that, for being willing to answer these questions. I'm sure that more questions will come, but we definitely will make sure that we're more educated and that we actually take the opportunity to go to the doctor and ask these questions of our actual physician. Dr. Pollard, you touched on a lot, but a few things that I really picked up on were one, schedule their birthday visit. So make it memorable. Make your birthday memorable by scheduling your usual appointments. Become actively engaged with your primary care physician. So actually engage your physician. Ask questions. Don't just go in and just say, yeah, I'm here to get my checkup. No, let's actually go in and have a good time and actually say, hey, doc, I'm here for this. I have some questions for you. Come prepared for that. And then one of the last things you really hit on, Dr. Pollard, was it's not only about surviving, but thriving. Our health is not just about us making it from day to day, but really making it from day to day with new energy, with renewed strength, and with a renewed mindset. And so you all, again, in the chat, let's show some love to Dr. Kelvin L. Pollard II. Thank you, Dr. Pollard, so much for what you shared with us today. And we look forward to being able to continue with it. We are so grateful for you and for your time today. Well, brothers, it's time for another round of amazingly great prizes. And so I got to bring back one of my favorite people. Katrina, let's do some more prizes.
All right, Darren, let's get some more prizes in here. Let's get it started because I know everybody wants to be a winner. So let's get this up on the screen. Gonna hit share. All right. So while we're pulling this up, are you all enjoying today's session? I think we're learning so much. And again, shout out to the one and only Dr. Pollard. Thank you so much, all the way from St. Louis University. He is from our community. I love when our community, we can elevate their voices to advocate for us. And he did an awesome job. So glad that you were able to join us today. So it's time for some more winners. All right. So now we get into the big prizes. So our next two winners are Mr. James Scarbrough and Mr. Brian Jarvis. So our next two winners are Mr. James Scarbrough and Brian Jarvis. So again, when the Men's Health Network will reach out to you with the email that you registered with, and they will get your mailing address, and we will get your gift card out in the mail to you. So thank you again for being here. And those are our winners. And we have one last winner, so don't leave, y'all. We got one grand prize that's left, and Judy's gonna do that at the end. So make sure you stay to the end because it just might be your name. All right, Darren, I'm gonna give it back to you.
You all, please don't forget what I talked about with the first set of prizes. If it's a food gift card, I love to have it. I am a foodie. So I would love for you to take me out to lunch or dinner with your gift card. Thank you all so much. I'm so grateful for you all, and congratulations to those winners. I am so excited now to bring to the virtual stage the one and only Carol Miner. Come on and join us, Carol. We're so glad you're here.
Thank you. Can you hear me?
Loud and clear.
Okay. Thank you for inviting me, Darren and Judy, to present on HPV. Today actually was supposed to be an opportunity for the students with the STEM program at Crosstown High and another school in Jackson, Tennessee, to present. But one thing about medical information, health information rather, is that it needs to be accurate. And we want these students to continue to work on their projects because eventually they will present the projects to the Tennessee Men's Health Network and also to their classmates. So I will continue to work with them to make sure that they not only are developing the presentation, but learning from the information as well. Last year, I presented to the Men's Health Network Summit, but this year, again, I wanted them to do so. But in my short time, what I want to do is definitely give you the information you need. First of all, HPV is the human papilloma virus. Can we go to the next slide?
Actually, Ms. Carol, you don't have your slides. We set it up where you could show your slides.
Okay, let me see if I can share. Can you all see them?
You should be able to share.
Okay, just a second. Okay, just a second here. Should be going.
Now it's coming up, Ms. Carol. There you go. Now we can see. Thank you.
Should be in presentation mode. Let me go back. Okay, I am a program coordinator with St. Jude Children's Research Hospital. I was listening to all the other speakers, to Dr. Pollard, to Hollywood, Mr. Thompson, and Sylvester Fulton, and it was just so engaging to hear them say some of the things that they said. One thing about it is, they kept saying, get screened, get tested. But before there is even a diagnosis of cancer, children need to get vaccinated. I know in the world of COVID, there's been a lot of questions about vaccines. Vaccines have been around for years and they have helped to eradicate many diseases. So the HPV vaccine is safe, it's effective, and it's long lasting. And we want our children, particularly in our community, to make sure that they get vaccinated. Let me move on to the next slide. For me, information is so important. You need to know what to do, not just that you need to do it, but what to do. And the HPV vaccine is routinely recommended for age 11 to 12-year-olds, but you can start as early as age 9. And what I run into is people will say, oh, I think age 9 is too young for kids to get a vaccine. As Dr. Pollard will understand as well, the uptake of the HPV vaccine in younger children is so much better. But not only that, when children are vaccinated before they're ever exposed to that virus, then their chances are greatly improved to not ever be diagnosed with the 6 different types of cancers that are related to the HPV virus. And as you can see from the chart, on time is between ages 9 and 12, and there are 2 doses, and you can get 2 doses up through age 14. But after age 15, you will need 3 doses. And that's just how the vaccine works right now. And earlier, when the vaccine first came out in 2006, everyone was getting 3 doses. So you can see the science is progressing to where we are working to make sure that the dosing is proper and that possibly they can get it down to 1 dose. But right now, we need to follow the guidelines and in protecting our children. Also, if you can't remember those guidelines, St. Jude has educational information for the general public. We have information for parents and caregivers that we share with a lot of our providers to use in their office to provide to parents who are a little bit hesitant about getting their kids vaccinated because they don't know enough about the vaccine or the virus. And we also do, we just recently did a seminar series, 3 series for healthcare providers to teach them how to effectively communicate and give that strong provider recommendation to get the vaccine. And also here at St. Jude, because we have childhood cancer survivors and their family members, we have information to them as well about getting the HPV vaccine, because once they have been diagnosed and treated for cancer, they are at more risk for a second type of cancer, be it an HPV cancer or any other kind of cancer. And our materials come in English and Spanish. And you can also see there's a QR code there where you can hold your phone and get that information as well. And I will say, after my presentation, Judy is always in contact with me, and she can get any requests for information to me. Also, St. Jude recently launched a Path to a Bright Future campaign. That campaign is to have our partners and allies and even individuals to sign on to our campaign to say, hey, we are with you. We want to get our children back on track with vaccines, especially the HPV vaccine. It's important because when COVID hit in 2020, the vaccine rates across the country, across the world, went down tremendously because, we were dealing with that, and people just weren't going to their providers like they normally would, especially children who were getting their regular vaccines. But we are working with organizations and individuals to help bring those vaccines back up to par, and actually to get the HPV vaccine up to the Healthy People 2030 goal of 80% across the country. And also, St. Jude and other partners in Memphis and Shelby County are hosting our second Barbecue Blues HPV Vaccination in You. It's an annual meeting for providers, for community organizations, for individuals who are committed to increasing the HPV vaccination rates across Memphis and Shelby County. One of our presenters last year, Dr. Jennifer Irves from Meharry, presented on information about what the rate for HPV vaccination completion is in Memphis and Shelby County. And we were all shocked to know that the rate is less than 3%. That is unacceptable. That is totally unacceptable. This vaccine, and let me say this if I didn't say, it's for boys and girls. Please, let's not look over that. This is the Men's Health Network. Again, let's look at making sure our boys are vaccinated. This is not a vaccine just for women. It is for boys and girls. Again, I mentioned the 6 cancers. Those 6 cancers are mouth and throat, otherwise known as oropharyngeal. And it is the highest diagnosed cancer based from the HPV virus, and more men are diagnosed with it than women. It has surpassed cervical cancer in diagnosis. So please don't let that comment go past you. More men are diagnosed with it. So let's get these boys vaccinated now so that they will not have to deal with that issue of mouth and throat cancer from the HPV vaccine. Also cervical cancer, vaginal, vulvar cancer. And for both men and women, anal cancer is another cancer that is one of the cancers caused by the HPV virus. And also penile cancer is another one of the cancers caused by the HPV virus. So you see, men, you are definitely counted in this fight against the HPV cancer by making sure that your kids are vaccinated. And here in Memphis, and I have to keep my city straight because I just moved here from Nashville, but here in Memphis, there's a back to school immunization event. There are actually several of them. The next one coming up is July 16th, July 23rd, and August 6th. And you can see here the various locations where they'll be held. I know my time is short, but I just want to say the vaccine is safe, it's effective, and it's long lasting. It's for boys and girls. I do not want you to miss out on that message. It is for boys and girls. It can be given as early as age 9. Do not think as a parent or grandparent or anyone who is in the life of a child, oh, that's too young. No, the vaccine uptake, the effectiveness of it is better when they get it earlier. Let's not play doctor because I know a lot of people do that, but listen to the science, listen to this information that we're giving to you, and go get your children vaccinated. Our children in our community and communities of color is so important that we have this information. Let's have a relationship with a primary care provider, with a pediatrician, even if it's at the health department. Let's have that relationship. Let's get our kids vaccinated. Let's save lives against HPV and HPV cancer. Thank you.
Carol, thank you so much for that information. We appreciate it. One thing that I was definitely reminded of from your talk was children need love too. I know that this is definitely a men's health summit, and we focused a lot of our attention on men of a certain age, but it is very key that we make sure that we understand that children need the same love and care for their health of all ages. And so I appreciate you sharing that. And as I shared earlier, as a future father or a father who to be, I needed that information that will carry my wife and I as we continue the journey of loving our son when he arrives here, despite all of the crying and the the diapers. We're gonna love him all the same.
That's great. That's great. Thank you.
Thank you, Carol. We really appreciate it. Thank you for sharing that information. Well, Katrina, I think that it is time for a poll from our participants.
Absolutely. It is time for us to have a poll. So we have a very short poll. Everyone, if you would, please complete the poll. You should see a little poll pop up on your screen. It's really short, 3 questions. And this is important. And the reason we kept the poll short, because we have known from doing this event, you ask more than 5 questions, they not gonna answer them anyway. But we want to have your feedback. So please complete the poll, because when we're in these planning committees, we are really striving to bring you all good information, great speakers, and we want to make sure that we're hitting the mark, because we want to make sure we're being good stewards over our time and the efforts that we're putting in. And we want to make sure we're good stewards of how our sponsors support us. So we take this work that we do in the community very seriously. I know you all don't know all the things that happen behind the scenes, but we work really hard every year to present this, because we know that men's health matter. And we need our men, our fathers, our dads, we need all of y'all to be a part of our lives. And we want to break these barriers. We want to stop the myths and the stigmas that keep men from going to the doctor. So it looks like everyone has participated. So I'm going to share the results right quick. So thank you all so much for sharing. Oh, I love seeing excellent. That makes us very happy. That makes us very happy. Darren, we have done it. We got some excellence. So I don't know about y'all. I'm gonna be super excited and shout, because I was like, okay, we have got to get this thing together. And it was important to me that we did it the first weekend in June, because it's Men's Health Month. You all know when October comes, you're gonna see tons of pink. Eventually, we're gonna get to the place where you're gonna see nothing but Memphis blue everywhere. So that's gonna be our goal next year. We're gonna have Memphis blue everywhere. We're gonna get some more organizations to come and run this race with us, and just help us continue to do this work that we do to serve our community. Back to you, Darren.
Well, friends, we're just about done here. I know the hour is drawing, as they would say in the older places, nigh. The hour is drawing nigh. That time is ending. I know you ready to cry, because I am too. But you probably also weren't ready to go outside and enjoy this nice weather. And I know that Carol's presentation that talked about barbecue made you start to get a little hungry. So I know your stomach might be touching your back. And so I want to make sure that you got time to go and enjoy whatever brunch plans that you do have. And so I want to thank you all so much for allowing me the opportunity to serve as your host, your moderator, your MC, whatever the title that you wanted to use today. I hope that you have thoroughly enjoyed it and felt entertained. My hope is that one day we can do this in person, because I'm much funnier in person. And I will do a lot of backflips, jumping around, doing cartwheels and all kinds of things in person. But I am just so grateful for this opportunity. Now we'll have a recap of the Men's Health Summit from Dr. Rajesha Ramachandran. Did I say that right, Doc?
Just Dr. Raj is fine.
Perfect. We'll have these closing remarks and recap of the Men's Health Summit from Dr. Raj, followed by our call to action and final door prize from the one and only Judy Seals Tugboat. Thank you so much, you all.
Good morning, everyone. I just wanted to say how excited and privileged I feel to be a part of this summit. And I've been involved and had the privilege to be part of this summit for the last few years. And it's something that I really look forward to. So I thank all of the organizers collectively for the invitation. It's my pleasure and honor to be here today. Darren and Katrina, excellent energy. I have really enjoyed watching you both host and bring so much energy to this summit today. And I love that Memphis backdrop. It really highlights the beautiful city that we live in, and personally, one that has now become my home for the last several years. I originally grew up on the East Coast in the Delaware and New Jersey area. And I joined GastroOne, which is my gastroenterology group, in 2016. And since then, I've been in this area, and it has really, truly been my absolute pleasure and privilege to make Memphis my home, and more importantly, to be involved in the healthcare of our community here. And as a gastroenterologist or a stomach doctor, colon cancer and other gastrointestinal cancers are very near and dear to me, and something that I see and deal with every day. Dr. Pollard, excellent presentation that you had given as far as the screening guidelines and recommendations. And it was just a marvelous presentation. One of the most important take homes that I can emphasize from that presentation is to get screened. Sometimes the information can be a lot, sometimes it can be overwhelming, and sometimes we can fall into what I call an analysis paralysis, where you think too much and in the end you end up doing nothing at all. And so in a situation like that, establish that relationship with your primary care provider. I think that had come up, before as well, in terms of how important that relationship is. And, I think one of the questions, in fact, really hit a nerve with me, which is, how do you establish that relationship or know if your primary care provider is the right fit? And I think Dr. Pollard answered it beautifully. And just to add to that, a doctor-patient relationship or a provider-patient relationship is just like any other. It's a relationship. You want it to click, and you do your best to make it click, but sometimes it doesn't. And if that's how you as a patient are feeling, then speak to your community, speak to your friends, speak to your family, to your coworkers, and see if there's perhaps someone else who better fits and meets your needs. From a screening standpoint, I'm not going to go into the details of every individual test, since that has already been covered so beautifully, but I'd like to take some time just to talk about some of the messages and some of the emotions and some of the stories that I hear just on a day-to-day basis. As someone who does colonoscopies every day, I see a good bit of cancer as part of my practice. And as frequently as I see it, it is never, ever easy to see a colon cancer, or any cancer, but specifically colon cancer, because we have such good tests to be able to prevent colon cancer. And when I speak to my patients who have colon cancer, oftentimes they may not have ever had a colonoscopy. And that is really disturbing to me, because when we look at our statistics and we look at all our data, our African-American population has the highest risk of colorectal cancer as far as incidence rates, as far as mortality rates. That means people who are dying from colon cancer, of all the ethnic and racial groups in the United States. And that is not because African-Americans are genetically at higher risk of colon cancer. This has to do with access to care. It has to do with access to screening and a lack of awareness. And that's what we are trying to change today. And with our annual summits, is to increase that awareness and to emphasize how important it is to get yourself to a provider who can then recommend the appropriate screenings that are necessary so that you can maintain and be in good health. Sometimes the term screening or the word screening can be one that we don't think about often enough, but screening is something that we talk about to find an undetected disease or condition in someone who has no symptoms. And I think Dr. Pollard had alluded to this in the presentation. You know, you meet patients of mine so often who say, I feel great. I feel wonderful. There's nothing wrong with me. And I said, and I will say, I am so happy about that you feel well. But due to your age or due to your family history, it is time for screening. And being a gastroenterologist, I focus on colon cancer. And so we talk about colonoscopy and alternatives to colonoscopy. And about risk factors. And many patients will often ask me after I've done a colonoscopy and I find polyps. Polyps are growths in the colon that over time can turn or develop into colon cancer. And that is a very slow process. For a small growth or polyp to actually turn or develop into a colon cancer can take years. And so when we do colonoscopy or a camera test to look inside the colon, we are looking for those polyps, and we can then simultaneously remove those polyps at the same time. Depending on the number of polyps that someone may have, the type of polyp that it is under the microscope, these are the and the size of the polyp, these are the factors that will then determine when one should have their next colonoscopy. But going back to risk factors, when I find polyps, someone will often ask me, well, hey, why did I get these? You know, why do I have these? And some of it is family history and genetics, and that, of course, we don't have control over, but I like to focus on what we do have control over. And the risk factors that can contribute to colorectal cancer are several. One of them being overweight or obese. And oftentimes we have a lot of euphemisms in how we talk. You know, I'm a little fluffy, I'm a little chubby, I got a little extra meat on me. These are all things that we say in spoken English to imply that we are a little heavier than we should be. But the terms overweight and obese are medical terms, and they have strict definitions based on BMI or body mass index. And it's important to know what is your body mass index, which is calculated based on your height and your weight. And that can easily be calculated as part of an annual physical, again, with your primary care provider. But knowing whether you are overweight or obese, and if so, how obese you are, is helpful. And it's not meant to create a stigma, but rather to empower and to enrich and to say that, hey, this is a risk factor that we should do something about. Along with that is not being physically active. I think, Darren, you mentioned about getting out there on this beautiful weekend and enjoying some exercise. And that is something that I have heard so much pre-pandemic, but especially during the pandemic, in terms of exercise routines. So many of my patients have demonstrated weight gain during the pandemic because our lives, our routines have all been turned upside down. And this is something that is, there's, I guess, some insult to injury in Memphis because the weather can be a challenge. It's incredibly hot. It can sometimes be cold, rainy, stormy, a mix of all of those. So it's really important to develop and think about an exercise routine that is not entirely and wholly dependent on the weather. And of course, for many people, that was joining and going to their local gym, which of course, did not become an option at the time of the pandemic. Now, of course, that has changed for many. But I really would encourage you all to think about something that is less seasonal and that can really be kept up over the course of the year. Because when you think about it, we have hot summers, we have cold winters, we have finicky springs, we have erratic days in the fall. So that really filters down the number of days that you can get out there and enjoy the weather to far less than what constitutes regular exercise. So this is a good discussion to have, with your loved ones, your friends, your family, about how can I make my exercise more regular. Maybe that means, considering going back to the Y, or joining your local gym, or maybe even investing in a piece of equipment at home that you enjoy using, joining a group that can keep you motivated. So many different options are there. But not being physically active is a risk factor for colorectal cancer, as is being overweight or obese. And so these are risk factors that we should pay attention to. Diet, a diet that's high in red meats and processed meats, is another risk factor. So as we think about what we eat, what we put into our body, I think Mr. Hollywood had mentioned you have one life and you have one body. And we need to take care of that one life and that one body. And diet has a huge part to play. Not that you can't ever have red meat or you can't ever have processed meat, but you really want to think about how much of that am I having? And is there room for me to cut down? And what can I replace that with? Am I getting enough fiber and fruits and vegetables? And how can I incorporate more? Your primary care providers can often even link you with a dietitian. Many of the dietitians that I work with do online virtual visits, just like this summit that we're doing now, and can really provide excellent advice, even for people who have specific medical conditions, whether it be diabetes or blood pressure or cholesterol or all of the above. Sometimes it's hard to figure out, what I should eat and what I shouldn't. And that's where sometimes some nutrition advice can be really helpful. Smoking. This comes up again and again and again, not just with colorectal cancer, but with so many different kinds of cancers. I know we most often think about lung cancer and smoking, but there is certainly an increased incidence of colorectal cancer in smokers. So to the extent that we can think about quitting, I would definitely encourage that, at least cutting down and getting to that mindset where we can think about quitting. And the last risk factor is moderate to heavy alcohol use. So between smoking and alcohol use, diet and physical activity, these are the risk factors that are within our control, that we can do something about. And that brings me to my next point, which is mindset. And this is not something that I think previously talked about in any prior Men's Health Summit, but as I have thought about mindset more and more, and just really had a lot of discussions with my patients over the years, it really makes it clear to me how important mindset is. Some of you may have heard of may have heard of a fixed mindset versus a growth mindset. Fixed mindset is when we say to ourselves, I'm not good at something and I'll never be good at it. I just don't have the talent. I don't have the skill. I wasn't born that way. Versus a growth mindset is one that says intelligence and talent can be learned with practice and effort. And I encourage us all to transition more towards growth mindset as opposed to a fixed mindset as it applies to our health. So just to give you some non-medical or non-health related examples, a fixed mindset would be something like saying, I'm not good at math. I never have been, never will be. Versus a growth mindset would be, math is challenging, but I know I can improve. So let's transition that example to something like smoking. I'm not good at quitting smoking. I've tried it before. I couldn't do it. Fixed mindset. What about a growth mindset? Quitting smoking is difficult. It's challenging. I've tried again and again, and I have failed. But I know that it's important for my health, and I will try again. That's the difference. Another example. Other people's successes make me feel bad about myself. Fixed mindset. What would a growth mindset be? Growth mindset would be, other people's success inspires me and they show me what is possible. So that can be from anything from losing weight to making that first appointment with your primary care provider to getting that first colonoscopy. These are all things that can sometimes instill fear, that can instill anxiety, that can really create a lot of internal turmoil. But with the growth mindset, you tell yourself what is possible and what you can do and not what you can't. And so I think that really applies to health in so many ways when we think about these risk factors that I was just talking about, whether it's weight or exercise, or quitting smoking or cutting down on alcohol use, or even taking those medications. There are so many reasons why we can't do things, but let's focus on the reasons why we can and why we should. And Dr. Pollard, I think in his presentation had mentioned that there are screening tests for different types of cancers, but what is unique and so powerful about colon cancer screening is that it can prevent that cancer from ever being a part of that person. So for example, with lung cancer screening, you can pick up a lung cancer very early, and that is extremely beneficial because when cancers are picked up early, they can be treated in such a way where that person can be completely cured in many situations. With colon cancer, we can go one step further and say that screening prevents that colon cancer from ever developing in the first place. And so, I would like to leave you with a few thoughts. One is building on what Mr. Hollywood said, that you have one life and you have one body. And so please take care of it to the best that you can. Can't go out and buy a new one. You can't go out and buy a new part like we would do for our cars or, for any of our equipment that we use. The second thought that I have is invest in yourself. We invest in so many other things in life, whether it's, a garden, if you're passionate about gardening, or a car, if you're passionate about cars, or shopping, if you like shopping, but invest in yourself. Take time to invest in yourself. Another thing or another pearl, I guess, that I would pass on is, and this can sound, I guess, it may not come out the right way, but sometimes I often hear my patients tell me, I don't have time, or if I'm not at work today or tomorrow or next week, then such and such won't happen, or this won't get done. And what I have learned to tell my patients is that many people may not care about you except you and your loved ones. So take the time to care for yourself. The world, the job, everything goes on. It will go on. There will be a way for things to happen with or without you. And sometimes we feel like that's not the case, but take the time for yourself. Perhaps you may not have an employer that will tell you, go and take care of yourself, go and get your physical, meet with your primary care provider, but you make that time for yourself. And that's something that you need to take that bull by the horns and do. And so keep that growth mindset, invest in yourself, and reach out to your primary care provider to discuss the screenings that are appropriate for you. Certainly, as far as colon cancer screening is concerned, 45 is now considered the age to start with colon cancer screenings. Family history and those factors make a big difference in terms of whether we need to start even earlier than that. But on average, 45, and this is for men as well as for women. Obviously, this is a men's summit, so we're focusing on our men's health, but that applies to everyone. And that is in the absence of symptoms. So this is for people who are not seeing blood in their stool, who are not having abdominal pain, who are not seeing any change in their bowel habits. But like a like a plant, we need to take care of ourselves. You need to water yourself. You need to add a little fertilizer. We need to trim those leaves back and those stems back. And most importantly, we need to be patient. We need to allow grace for ourselves with respect to our health. Things take time, just like a plant grows over time and blooms and gives us beautiful blossoms. That's how sometimes a primary care visit can be. At times overwhelming. Maybe a lot of tests are ordered. Maybe there's a lot of lab work. Maybe there's a follow-up visit. There's sometimes feels like there's a flurry of activity. Get this done, get that done. But in the end, that's an investment in yourself. And ultimately, that's what allows that one body to flourish and grow and remain healthy for your community. Thank you.
Thank everybody. This has been wonderful. And most of all, I would like to thank the two doctors, because even though Dr. Raj has been on before, he has something new to say. And Dr. Pollard, I am just so glad you're with us. You brought some new life to this program, and thank you so much. And I want to say before I forget it, for those of us that's left on the call, I want to give a big shout out to Meharry Medical College. This is their product. He is absolutely wonderful. I also want to thank all of my committee members who stood by me for late meetings, incomplete meetings, because I am not a Zoom person, and we were stuck on Zoom. I gotta give this shout out once again. Ladies, you rock. Our committee only had 2 men on our committee, and we made this happen. And I kept thinking, we're gonna miss something. We're gonna miss something because we don't have enough input, but we did. It's wonderful. And I'm going to take the time to invite you all to the 14th annual Men's Health Summit, which will be Saturday, June the 3rd, 2023. Not in the same place. God, we're going to be in person. I can't take another summit. And I want to encourage everybody to do what we need to do to grow our boys to men and not repair our men. We just can't repair them. It's too much trouble. And they are the head of our households and the head of our house, the world. And this is why so many things are going wrong, because we have not prepared them to not only take care of themselves, but they're not family orientated. They have no clue. And we've just got to work on that. Men's Health Network is also able to provide help with your health fairs or your health education programs. So if you will give me a contact, a shout out at 901-830-9886. And I think Katrina is putting that in the chat. I would appreciate hearing from you. Dr. Ra, and I'm not gonna mess his name up, was named our Man of the Year for 2021 because he's always available, even on short notices for other things. And his information we couldn't do without. In lack of awareness about smoking, I need to backtrack on that. This vaping is out of control. I had the pleasure, not so much a pleasure, I was sitting on a couple of campuses waiting on children that I was transporting. And one of them got in the car and she didn't know what's going on. She's 13. And everybody that passed by us, smoke was like, I mean, it was just coming everywhere. She said, what's wrong? What are they doing? They are vaping, darling. Do not do that. It's bad for your lungs. We've got to watch our children. We got to know what they're doing when they do it. These latchkey kids, that's not working for us. We are people of color, and we need to do what we were taught to do by our grandparents. On that note, I want to encourage everybody to go to the HPV Barbecue Fest on September the 21st. I didn't get a time on it, but we need to get you to come out, bring your children, bring your friends' children, neighborhood children. Just make sure that people around you are aware of this festival because it's very important. The next thing is that on September the, I just lost the date, September the 17th, do not forget the prostate pedal and prayers. And you can use the 901-830-9886 to also contact me on that. And I thank you so much. Ms. Katrina, I think we're ready for the last and final joy.
You have it, Miss Judy. You don't have, okay,
have.
Yes, it should be the very last winner is Mr. James Leon. He is our final winner for today.
Thank you so much, Katrina.
All right, well, this brings us to the end of our program. Mike, would you like to come back and make any final remarks? Again, we want to thank everyone that served on the planning committee. We want to thank Mr. Darren Thomas. He did an amazing job as our moderator. Definitely want to thank all of our doctors, Dr. Raj and definitely Dr. Pollard. We are grateful for the mayor being here today. Chaplain Conway, thank you for stepping in and praying for us today. Prayer is always in order. And again, my name is Katrina Kimball. I'm just glad to be part of this planning committee. And again, remember, June is Men's Health Month. Go out and wear your blue, show some support, and remind your loved ones to go to the doctor. Even if you have to take off work and take them, you have PTO, you're not using it anyway. Take your time off and take your loved one to the doctor. With that being said, I'm gonna turn it back over to Mike.
Thank you, Katrina. And I just got one last announcement, and that is if anybody's interested in becoming more affiliated with the Men's Health Network and more in becoming a health educator within their community, we have a program. It is our Certified Men's Health Educator program. And I got a flyer. I'm not sure if you can see it or not, but I'm going to have this sent out also with all the follow-up stuff from today's summit. And it's a self-paced virtual learning. And once you have completed the training, you will be a certified men's health educator, which means you will have the knowledge that we have and that you can apply that into your communities, host events like this, and help get this community back on track. Because Memphis, unfortunately, does have a lot of problems, as the mayor alluded to earlier, but they're certainly something, they're problems that can be easily fixed as long as we work together, and health is one of them. So for more information on that, please contact myself or Judy, but that program is going to be launched this month during Men's Health Month. So that's the only announcement I have, Katrina, but I want to thank everybody. I want to thank Darren for emceeing this fantastic job. And we look forward to seeing everybody in person next year. We've got to get back together again. The fellowship that exists when we are all together in one room, talking real talk, there's nothing like it. So let's cross our fingers. Let's hope we can put this pandemic in the rearview mirror once and for all. And go out there, everybody, and have a wonderful day. And God bless.
Thank you, everyone. This is the end of the webinar. You all have a great day.